Next is your type 2 diabetes mellitus. Now, what happened in type 2 diabetes mellitus? As you know that our pancreas produce insulin to absorb the glucose. But if the pancreas will not produce the insulin in sufficient amount, then lot of chances are there that you can acquire type 2 diabetes mellitus. For example, just assume or just suppose that your body need 500 ml of insulin to you can say absorb the glucose. But if 500 instead of 500 ml your body is producing only 250 ml of insulin, so what will happen? Your blood glucose level automatically get raised, so and you will acquire the type 2 diabetes mellitus. So this is the difference between type 1 and type 2 diabetes mellitus. Because whenever any diagnosis that is made in the hospital, doctors always write on the file that it is type 1 and it is type 2 diabetes mellitus. So you can now feel the difference between that what is the difference between type 1 and type 2. Okay, type 1 diabetes mellitus is a autoimmune, means your cells of the pancreas that will get damaged and insulin is not producing. And what happen in type 2 diabetes mellitus, that your pancreas is working, but the pancreas will not producing enough insulin so that it can meet the demands of the glucose. Okay, and your glucose level gonna high. So this is the type 2 diabetes mellitus. Then next is your pre-diabetes mellitus. Now, what is pre-diabetes mellitus? Pre-diabetes means before. So, whenever the person, before diagnosing the person with type 2 diabetes mellitus, the patient or person is showing the signs symptoms of type 2 diabetes mellitus, that is known as pre-diabetes mellitus. Means this is a stage, you can say, before the type 2 diabetes mellitus. Means your blood glucose levels are higher than the normal, but not high enough to be you can diagnose officially with the type 2 diabetes mellitus. So this is a condition before the type 2 diabetes mellitus. So this is known as pre-diabetes mellitus. Okay, and the next type is your gestational diabetes mellitus. So gestational word always you can say refers to the pregnancy. Okay, so if the blood goes, sometimes what happen in the pregnancy, the blood glucose level gonna high. Okay, so this is the type of diabetes mellitus the females mostly acquire in the pregnancy. But sometimes what happen, it can get resolved after the delivery of the baby. Means you deliver the baby and you will not be too much long suffered with gestational diabetes mellitus. But there are various chances are that you can say high risk is there if you have acquired the gestational diabetes mellitus in your pregnancy. So it can be possible that after the delivery of your baby you can get diabetes mellitus. But sometimes in some cases it can resolved after the delivery of the baby. So this is known as gestational diabetes mellitus. Next is your type 3C diabetes mellitus. Now, what is type 3C diabetes mellitus? This is a type of diabetes mellitus when your pancreas get damaged or your cells of pancreas get damaged rather than autoimmune reaction. For example, suppose if the patient or person is having a cancer of pancreas, or if the patient is having some pancreatitis, means inflammation of the pancreas is there, means the organ pancreas itself suffering from some disease, then in that condition the pancreas will not produce the sufficient insulin to absorb the glucose, and in that condition high risk is there, or you can say chances are there that patient can acquire type 3C diabetes mellitus. So this is what you mean by type 3C diabetes mellitus. And next is your LADA, that is latent autoimmune diabetes in the adults. So this is also like a type 1 diabetes mellitus, which is a result of autoimmune reaction. But this disease occur very slowly, means after the age of 30. And this is also the reaction of autoimmune reaction. Okay, so this is known as you can say latent autoimmune diabetes mellitus. So next is your neonatal diabetes mellitus. So the word always refers to like neonate, that is newborn baby. So this is a type of diabetes mellitus that the mostly newborn babies acquire within their 6 months of life. Means a newly born baby within 6 months of life can acquire diabetes mellitus, and this is a, you can say, monogenic form, and it gonna permanently lifelong diabetes mellitus. So this is known as neonatal diabetes mellitus. And the last one is your brittle diabetes mellitus. Now what is brittle diabetes mellitus? It is also you can say type of type 1 diabetes mellitus, but it can be you can say marked by the frequent episodes of diabetes mellitus. Means what happen in some cases, the glucose level it gonna high, and sometimes it gonna decrease. Means at one stage the blood glucose level get increased, and at one stage uh, you can say the blood glucose level get decreased. So there is unbalance in this disease. So, and this is known as you can say brittle diabetes mellitus. But in advanced stage it can lead to diabetes mellitus type 1. And in this disease mostly the pancreas transplantation that is advisable, because this is a form of type 1 diabetes mellitus, means the autoimmune, okay, autoimmune reaction. So it can mostly leads to pancreas transplantation. And this is all you can say about the main types of diabetes mellitus, which is the most common disease in our body. Now in our next video we can discuss the main signs symptoms of diabetes mellitus, that from where we can judge or we can know that this patient or this person can be the case of diabetes mellitus. So in our next video we can discuss the main sign symptoms, main treatment line of the diabetes mellitus, as well as what are the main complications that can lead to diabetes mellitus. So till that, thank you for watching SKK Classes NZ, and don't forget to subscribe my channel and share it as much as you can. Thank you.